শেষ না?
It was reported as a schwannoma, and the tumor was behind the carotid artery and the IJB. So that gives you the impression that it was probably a parasympathetic, or rather the sympathetic chain schwannoma. If you can't be sure, it might have been a vagal schwannoma. So if you have a parapharyngeal stage schwannoma, the commonest ones are going to be either from the sympathetic chain or from the vagus. Either way, his vagus was paralyzed post-treatment, which is probably a very reasonable price to pay for the tumor that he had quite anticipated. Whether it's permanent or temporary, we are not so sure. But certainly he's very hoarse and very breathy. He has no problems with swallowing. But if you do a fiber optic scope, you do see that there's a fair amount of clotting gap and going. So what we do is that we do the fiber optic bronchoscopy now, and with that we'll also do a little bit of local anesthesia.
Medialization করব
And you can see as to what it looks like, and we will give him an anesthesia. We'll follow that up with a superior laryngeal nerve block and some local xylocaine, and then we will give the injection in a trans-thyroid fashion. So we do that again. Can we say his nose, please? Straight the nose, yeah. So only the left side, the right is not required. सबसे खराब यही है, first part. Jelly? अच्छा ना. Jelly. ठीक है, this is good. This is jelly? Okay. चलो तो बेटा. And that's skin marking. Skin marker we have. Have you got the skin marker? Clinical skin marker. For the transfer, we need a 1.5 inch. Well, don't need 18. 20 will be good, 21 is also good, 22 is also good. So you can see the larynx, can you? You see the picture of the screen?
Yes, you can see.
Say E. E. Can you hear it?
Yes, sir.
And you can hear that it's very, very busy. Yes. So now we give the laryngeal gargle anesthetic, and you give the anesthetic. So you know what to do.
লেফট
And you say, we'll get some fluid and you will maybe cough on it. So, say,
অবস্থা
Okay, stop.
So you are injecting lignocaine
Yeah,
through the working channel.
through the working channel, while he is phonating, don't do it very.
Okay, doing laryngeal gargle.
So say E again. Yeah.
ও এটা যখন দিতে হবে তখন ই বলতে বলে তখন মানে বন্ধ করে
So that's
তারপর
the local anesthetic and the topical anesthetic on the supraglottis.
Surface anesthesia.
That is done. Coming out, sir. Hold that. I need a smaller scope, Sure. Give me the xylocaine to inject. Give me the xylocaine to inject. The Rekan button खोलो.
So, sir, which filling material will we use? Sir, which filling material?
So I'd also like to give a superior laryngeal nerve block to numb the ipsilateral larynx on that side. So basically I'm palpating the cricothyroid space now, and we know the superior laryngeal nerve enters the cricothyroid space at about the horizontal midline.
আরে দূর
Turn it on light.
ক্যামেরা কোন জায়গায় আছে এটা বলছে না কেন
We have a headlight, it will be nice, or any we don't like it.
So it is thyroid space of cricothyroid.
So I'm going to the thyroid space.
Okay,
We
sir.
can only give local anesthesia. At the moment, my objective is to.
Sir, can you tell the landmark on where you are injecting landmark?
So you inject midway in the thyroid space, midway superior inferiorly and anterior to the cornu. So I'm palpating that area and I've injected now also.
Okay, corner.
Give me some more.
Greater corner of the highway.
Yeah. Do you have a skin marker?
Approximately 1 centimeter from the greater corner.
So now I'm
কলম
marking the thyroid notch, and then I'm marking the lower end of the thyroid cartilage. I need better lighting, and I'm marking the posterior end of the thyroid cartilage where the cornu is. So basically, the vocal fold, you know, is at about the midpoint, the horizontal midpoint of the thyroid. So that is the level where I expect the. I need a better pen. Sorry, yeah. दूसरा pen दे दीजिए. Thank you. So this is where I expect the vocal fold, the horizontal level, and in terms of the vertical point, this is the midline, this is the thyroid cartilage, the posterior cornu. Again, you draw the midline of this, and really now you have the point where the vocal process should be, which should be here. So I would expect the erythenoid to be something like this. This is the surface landmark, and it should be erythenoid here. And now I know where I need to inject. That is local anesthetic. Local anesthetic. So I'm taking local anesthetic, which I'll inject in the tract. Sorry. I'm injecting local anesthetic on the still the thyroid cartilage. I can feel the thyroid cartilage. So I need someone to put in a flexible scope. And I need the injection that the Restylane. Give me the Restylane. The Restylane which was in that packet. सर थोड़ा सा ऐसा होगा. Restylane है ना जो आया हुआ है. ये रहा ना खुला हुआ. ये Juberderm को. हाँ ये खोल दिया. हाँ. So I need a 1.5 inch needle. So this comes with 2 needles, but these needles are for skin injections, and these are very short, so these will not work. Normally, the Juberderm or the Restylane is used for. Yeah, thank you. So this is a 23. So where's the camera? छोटा वाला सोप डाल दीजिए. छोटा वाला डाल दीजिए. Why needlessly? So this is a lower lock, as you can see. So you can tighten your needle around that lower lock. And this is 1 cc. So now we're ready. I need a little bit better lighting. Someone needs to get me better lighting, either a headlight or some light or whatever. Show me light. Whichever thing that this light is good. So sir, this will go through your nose again, eh? It will go through the nose so that we can see that we are injecting in the right place. So keep sit straight now. पीछे हो जाओ. Sit straight.
So for the residents here, sir is injecting transthyroid.
Give me a.
This is transthyroid approach, and another approach is cricothyroid, and another is thyroid. That is, we call it superior and inferior approach, and this is lateral approach.
Don't need to go too far now.
This is lateral approach.
That is good enough.
Sir is doing lateral approach.
Hold that. So we give an injection, you try not to move and you try not to swallow. है ना, कभी कभी तो करोगे ही, but फिर भी you try. So this is the point we had identified where you want to inject. I go in, I feel the thyroid cartilage. I feel the give as I go through the thyroid cartilage. I go in a little bit more and I move my needle to see if I see any movement. Not so obvious.
রিটেনার যে লাগছে নাকি
I'm wobbling my needle in the hope that I'll see something. Very good. Where do you see the needle?
I think above the anterior conchoid, something is moving.
Where I
না না কোনটি
Boshikan.
It's in the yeah.
হ্যাঁ 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 হ্যাঁ
So the vertical level is pretty okay, but I was angling it forward.
কারণ ব্যাক নিয়ে আবার দেওয়া যায় না
Where? Yeah, that would help. ठीक है सर perfect. See? But very anterior, huh? Still high.
ওই পাশেও দিচ্ছে নাকি আর এক পাশ দিয়ে দিছে তাই তো দেখতেছি
I would like to position it a little bit lower than that. Can you see the needle?
Yes, yes.
Just a little bit there and then withdraw. You can see the injection. And withdraw it. Can you see it fill up there? The E. Very good.
কাশি দিক কাশি দিয়ে খায় নি এই ব্লাড দিচ্ছিস না ব্লাড দিলে তো
Over injecting a little. The E. Very good. Very good. Yeah. It seems a little bit high.
একটা এফওএল জীবনে আর ইয়া করতে পারলাম না। টিএমসির মতো জায়গায় যদি একটা এফওএল না থাকে।
And now push myself a little bit lower and I'm injecting more, you can see. I injected most of it. And I come out. Say So he correctly sounds strained, which basically means that he over-injected. But what happens is that as they now vocalize and as they now hum, this will redistribute. And as it redistributes, he will actually get better. You can give him a week or so to continue with humming exercises and he'll get better. Say नाम बताइए। ठीक है, लंबा चलो सर, we are done. You can take it out.
Okay.
This is the injection. Of course, this is a little bit of a, what should I say, fairly precise. But at the end of the day, when you have injected, you want it to redistribute, and it will redistribute as it starts to vocalize. So it will get better over time.
Sir, can you hear us?
Yes, of course.
Sir, sometimes when you introduce the needle through the thyroid cartilage,
Yes.
sometimes a core of cartilage enters into the lumen of the needle.
Possible. Yeah.
In that case, what is your suggestion?
Well, when you push, I guess it will get pushed out. When you inject with the plunger, then the small core of the cartilage, if any, in the needle would get pushed out.
Okay.
Not a major concern. Yes.
Do you ever feel difficulty for ossification?
So there is this problem that males especially, and as they get older, cartilage will get calcified. Even in this particular patient, as I went to my passes later, I did have some difficulty because the cartilage felt a bit calcified. But because I'd given local anesthesia well, I had the confidence that I could push in with some force and do it. And as you saw, the initial passes were obviously not correctly positioned, but they could tell us as to how to reposition our needle so that we got a good positioning. I would ideally wish to start injecting just in front of the vocal fold, and ideally obviously at the level of the vocal fold, just in front of the vocal process at the level of the vocal fold. But with this kind of injection, you don't have to be that precise, because ultimately when you've injected, it sort of found its place both above and below the vocal fold. There is a bulge on both sides, as you can see, and this will redistribute.
Thank you, sir.
नाम बताइए कबीर जी। चलो, it sounds high paced, but you'll get better. It's actually better than what it was. It is much better than what it was. It is better than what it
Yes, better than previous.
And currently his voice would be classified as strained because he is having some difficulty in making his voice, because obviously he has a heavy vocal fold and he has to use more force to get this to work. But you will adapt to this. What you have to do is to hum. So you have to say, practice that, regularly practice that. Over the next week or so, you will find you are getting better. Very good, sir. Done.
Sir, a big hand for Alok sir.
Yes, sir. No. Yes, I want him to vocalize. I want you to vocalize. Use it.
স্যার অলোক স্যারের মাউথপিস থেকে যে আওয়াজটা যাচ্ছে ওটাকে ক্লিয়ারলি শোনা যাচ্ছে স্যার?
শোনা যাচ্ছে clearly.
Fingers crossed.
Now, Farhan, next, what you are going to do?
Sir, next patient is an elderly lady, is moderately elder, something around maybe 50 years of age, who has undergone a total thyroidectomy around...
So 50 years means young.
Yes sir, quite young sir. It's my mistake sir, I'm actually quite old. But she actually looks quite young and very energetic. So she has undergone a total thyroidectomy almost 3 to 4 months back. And sir, on the right side there was a bit of retrosternal extension, but sir, on the left side it was fairly normal goiter. After surgery, the patient was all right for 3 days, and on the third day the patient suddenly started to have voice change, and so there was a bit of aspiration and headache complaints as well. But although in the span of last 3 months, voice seems to have improved a bit, but there is one-sided palsy on the left side. So Dr. Brandon sir is here. He has been briefed, and he will explain what he is going to do in the next course of action.
Okay. So Dr. Brandon will also do injection laryngoplasty here, whether transcervical or transoral.
Sorry, it's specific. So you had hoarseness after your thyroid surgery, is that correct?
আপনার অপারেশনের পরে দুদিন পরে যে গলার ভয়েস চেঞ্জ হয়েছিল ওটাই আপনাকে জিজ্ঞেস করছি অপারেশনের পরেই তো বলেছিল
And did you have any hoarseness at all? I mean, did you have any swallowing problems at all after that?
আপনার কি কোনো ক্ষেত্রে কোনো সমস্যা So there was a bit of problem initially, but it has improved a lot over the span of time.
Liquids more difficult or solids more difficult for you, or both?
পানি খেতে বেশি কষ্ট হতো নাকি ভাত বা অন্যান্য সলিড খেতে? Okay, it was very normal with all kinds of solid food, but sometimes with liquid there was a bit of difficulty.
That makes sense a lot. So, and any breathing problems, any feeling like you can't get your air in as you're talking, or feeling like you're running out of air when you're talking?
আপনার আমি একটু বলি আপনার কি মনে হয় যে আপনার নিঃশ্বাস আটকে যাচ্ছে বা কষ্ট হচ্ছে কোনো হেভি কাজ করলে এখন না কখন মনে হয়
It's over there.
So when she does any kind of heavy activity, lifts up heavy objects, she finds difficulties, and every time she has a common cold, sometimes she feels that she is having a bit more problem than what is at home.
Okay. And how long ago was the thyroid surgery? When was it? No, we had the original.
It's in the month of August.
Yeah. A month in August, okay.
In the month of August.
Last year? Last
No,
year?
sir, this year.
This year.
Yes.
August 23.
What we'll plan on doing.
Sorry, sir, August 2020,
23.
2023, sir.
Okay.
So
Sorry, sir.
what we'll plan on doing is an injection. The way that we're going to do this is we're going to give you a lot of numbing medication for your mouth and also inject some numbing medication into your neck, okay?
তো আপনাকে এখন ইনজেকশন দেওয়া হবে ইনজেকশন দেওয়ার আগে আপনার নাকের মধ্যে একটা স্প্রে দিবে যাতে আপনার স্কোপ ঢোকাতে কোনো ধরনের কোনো কিছু বোধ করবেন না এবং গলাতেও লিকুইডটা আপনাকে দিয়েছিলাম না
Tongue bleed, tongue depressor.
সেটাই উনি বললেন
It doesn't hurt. You may feel a little bit of pinching
ওই পাশে
for
যাবো
a
নাকি?
quick minute, and then usually it doesn't hurt.
ওখানে যাবো নাকি?
তো আপনি আসলে কোনো ব্যথা পাবেন না
এনজয় করি।
ওই যে আমরা আগে যেভাবে করতাম
আমরা পিছনে খেয়াল করবো কাউন্সেলিং করে হ্যাঁ
অনেক সময় এই আপনাকে যে ওষুধটা দেওয়া হচ্ছে এটার নাম হচ্ছে রেস্টাইলিন এটা সম্পর্কে আপনি আজও বিস্তারিত জ্ঞান করতে পারবেন অনেক সময় এটাকে 2 থেকে 3 বার অনেক সময় দিতে হতে পারে কোনো অসুবিধা নেই বাট এটা অনেক সময় মাল্টিপল লাগতে পারে পেশেন্ট টু পেশেন্ট ডিপেন্ড করে সেই জিনিসটাই আমি বোঝানোর চেষ্টা করেছি একটাই না অনেক সময় এক এক জায়গায় ইনজেকশন দেওয়া হতে পারে আমরা দেখি কিন্তু আপনার গত 3 মাসে অনেক ইমপ্রুভ হয়ে গেছে
Stand up and give you a little bit of numbing medication, okay?
একটু স্প্রে দেওয়া হচ্ছে যেটা আমরা আগে দিয়েছি
Now you do a quick injection and small one. Okay. Then you do a regular thyroid injection. Try to cover a little bit more
ছোট্ট একটু ইনজেকশন দেওয়া হবে ইনশাআল্লাহ কোনো অসুবিধা নেই ডক্টর নাসিম ভাই
আপনারা এটা কি ইনলোকেট ইনজেকশন
vitamin, 2% vitamin.
ওকে সো আমরা আগে দেখছি ওয়াকিং চ্যানেল দিয়ে দিতে দেখছি এখন ডাইরেক্ট ট্রাকিয়াল লোমের মধ্যে দেওয়া হবে ডাইরেক্ট লোমেনে Brandon, what you are doing now?
Injection of lidocaine, microthyroid injection.
Trichothyroid gland. That's the space.
You taste that? You taste it better?
একটু কি তিতা লাগে গলায়? তার মানে আমরা জায়গা মতো আছি।
And then finally, I'm going to do a little injection similar to what Dr. Anisur did. Just do a quick superior injection. Okay?
ঠিক অলোক স্যার যেরকম সুপিরিয়র নার্ভ ব্লক করলেন ওভাবেই করছেন।
So you're going to do another little injection on the side of your mouth. Okay? So here's the thyroid cartilage is right here. Here's the thyroid notch. If I follow that path, and I can also feel the hyoid bone, this U-shaped bone here, or the space between the thyroid space. If you follow that path around, you'll get to the groove here, where there's essentially room for the anterior injection. Actually, have a relaxer a little bit more. If you have a relaxer, you'll be able to feel that space a little bit better. And then try to make sure that she doesn't swallow. So I'm going to go ahead and just do an injection right in this space. Helps if you actually hit the thyroid cartilage, you can walk your way up so you fall into the groove. And then once you're in the groove,
Brandon, when I block the superior laryngeal nerve, I usually do measure the distance from the tip of the hyoid bone. 1 centimeter anterior and then 1 centimeter inferior.
রিল্যাক্স করে এই এসিটা একটু ছেড়ে দেবেন
I
নাকি?
prefer to palpate it and kind of identify where the thyroid space is, specifically where the dip is in the superior cornea or the superior and the posterior cornea of the thyroid lamina. So just like give it a little bit of a faster injection.
একটু আপনি গভীরভাবে নিঃশ্বাস নেন এবং ছাড়েন। গভীরভাবে নিঃশ্বাস নেন এবং ছাড়েন।
আমরা এই দেখতে এন্ডোস্কোপি পিকচার দেখতে চাই।
And say
এন্ডোস্কোপিক
say breathe in. So you can see a lot of paralysis there. You can see an incomplete closure. Pretty parameting. So what we're going to do next is we're going to give her just a little bit.
বাবু স্যার
হ্যাঁ পারান
স্যার এখানে তো এখন ওই নিডলটা দিয়ে কেমনে লোকাল দিচ্ছে ওটাও দেখাবে আবার এট দ্য সেম টাইম এন্ডোস্কোপিক ভিউ থাকবে দুইটা কি একই সাথে দুইটা ভিউ কি একই সাথে করা যাবে?
আমাদের পিছন থেকে হ্যাঁ
So just breathe.
পিছন থেকে পারো হ্যাঁ এখন দেখা যাচ্ছে
So I use Restylane. And there's this washer here. I'm not sure if you can the washer. This is part here, the washer. The syringe goes inside the injector, and then the cannula attaches to the injector simply. So, and then the washers are important to keep the cannula. The washer keeps everything on board in place. Needle, 30 gauge needle from Integra. This comes from Integra microprints as well. These are single use only. Single use only. Very important you keep the cap because it helps you get the needle on and off. You're ready to.
একটু জুম করেন পুরো ইনজেকশনটা একটু জুম করেন
So you can control volume. And you have to make sure that you find. So you find.
It is 3 mm.
Find it. Single down. So we should be all ready to go now, okay? So.
আচ্ছা এটা কি মানে ইন্টারওরালি হ্যাঁ ট্রান্সওরালি ইনজেক্ট করবেন ট্রান্সওরালি এটা তো সহজ এটা ল্যাকটোজ আছে লেটার এই জায়গাকার একটু ছবি দিতে হবে।
All the way. There you go. That's good. That's good.
মনিটরটা শুদ্ধ দেয় মনিটরটা শুদ্ধ দেয় না
পিকচার চলে যাবে
Now, quiet.
এখন জাস্ট নিঃশ্বাস কোনো আওয়াজ
ব্যবসা
Yes.
This one
Nice.
is easy
Nice.
procedure.
Say A. Good. Hello. Good. E. Good. Deep breath in. Ha. Good. Good. Maybe ask her a couple questions.
কাম করেন
This tightness.
1 2 3
Good.
1 2 3
Here. Good. Hey. 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 Hello. Hello. Hey. Hey. What's your name? Big deep breath in. What's your name?
করে শ্বাস নেবেন
Big deep breath in first. What's your name? Good. Wonderful. Say hey. Good.
খাবেন কি কোনো রিকশা থামাতে হেই হেই
Great. I'm going to take a look, one last look, okay? No more needles. You're all done with needles.
আর কোনো ইনজেকশন দেওয়া হবে না, জাস্ট আমরা এবার দেখবো মা সব কিছু হচ্ছে না, সব কিছুই খুব স্বাভাবিক হয়েছে।
আবার নিঃশ্বাস
E. E.
You notice that
She has closure.
once the tongue extension is reduced by pulling the tongue, you can have a better sound and you see that she has good closure, complete glottal closure.
Again, E. E. So she has a lot of compensatory tension, so that's what the issue is.
Round of applause for all the teachers and most of you.
খুব সুন্দর হয়েছে
Sir,
নেক্সট ওয়াহিদ নেক্সট কি
কালার